Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare. Thanks for tuning into the latest edition of The Checkup. Leadership changes, as we know, are not always easy, and the ongoing COVID-19 pandemic has certainly added a new layer of complexity to those transitions within organizations. But what's it like when someone who's been in an organization for decades moves through those leadership ranks to take over the CEO spot? What kind of opportunities and even challenges does that level of stability offer? We're going to find out a little bit about that today from Dan Lundergan, who was recently named CEO of the University of Utah Hospitals and Clinics. Dan's been with the five hospital system for about 40 years, a little over 40 years, actually starting off in the laundry department. He was recently chief operating officer and had been serving as interim CEO since February. So, Dan, thank you so much for taking time to be with us. We know this is a busy time as you're moving into the CEO role without that interim title. So congratulations on that.
Thanks, Matthew.
I guess to start with, let's talk a little bit about what it means for an organization. A lot of organizations have an interim before they hire a full-time CEO. You've been in the organization for 40 years, as I mentioned. But once they pull that interim title off of your title, what does that mean for you in the organization? Does it change the way you operate?
It really doesn't, Matthew. I think that, we all as leaders, and many of you people that are probably viewing this, just have core values and your belief systems already established. So, and I think if when the organization is asking you to be interim, I don't think they're asking you to change your leadership style. I think they want you to come in as who you are, as the authentic leader that you are. My core values really is collaboration, trust, and mutual respect, and teams. And those are really fundamental. So by dropping the I, and the interim, that doesn't make any difference. I think that often what happens, your organization is looking for stability and looking for that transition to keep the organization moving forward, particularly in this area of what we're in the midst of COVID. So it's important to understand what is the organization it needs. And if you become a leader that starts to transition and start to act differently within the interim role and maybe start to react to other stakeholders in a different way and not being who you are and your core values, then I think you get to lose a little bit of you as being authentic leader. So no, I think that and also you come into this and you act like you own it, and you need to be able to do that, and you do that because that's what the organization needs. That's what the faculty and staff and the community is looking for, is that clear leadership and that stability.
Yeah, interesting. And you talk about that stability. You've been there for 40 years, or a little bit over 40 years, I think, right? And starting in the laundry department, as I understand. Talk a little bit about that journey for you and what you've learned about the organization over those 4 decades that is influencing your leadership.
Yeah, so the short story is, 19, as maybe many of us kind of kick around and trying to figure out, what we're doing. So I needed to get an education. The university offered 50% tuition reduction. So that was an attractive for me to come up for the benefits here. And that's how it got me through school. And then my journey kind of moved around, but I learned things at each stop. So laundry, just hard work. We had 2 individuals there that would come up from a school from the South. They'd come up in the bus each day. They would show up and they'd work hard. So for me, that was the first lesson learned, is showing up and working hard. And the next step would be, as I got exposure into the clinical area. We had at that time had a 3-bay burn unit. And if anybody's been into a burn unit, it can be very visceral. And so for me, coming into that environment as a young 22-year-old really taught me about the importance of clinical work and the importance of what our providers are doing each day and what they're committed to. Then I moved up into a laser institute, which then brought me into the academic world. It was a multidiscipline. We did education, research, and the clinical, and that was important because then it gave me a broader view of the academic world and the importance of the other missions. If a leader is focused in the area of just clinical and not recognizing the importance of research and education, I think there's a lost opportunity. And then I moved up into administration and realizing that the weight and the importance and the need for clear communication and what the organization needs. And that really became important about culture, and culture became very important. And what my lessons learned over the whole tenure was about relationships and how important relationships are. I have a saying that, never jeopardize a long-term relationship for short-term gain. And we're all in this for the long game. And so when you look at preserving relationships over time, that starts to build appropriate culture. And so now we move into where we are with COVID and the changes in healthcare and the dynamics, which is so complicated, and many leaders are facing this now. I mean, all of us are. The core need is that culture, and what culture we had coming into COVID, what culture now is being formulated and cultivated as we move through and out. Hopefully, maybe we'll never really be out of it. But all those become very fundamental in then how we work together and how we're developing our relationship. So one huge lessons learned in my journey here is that how important those relationships are. You need to come together and understand the commonalities. You will work through the differences if you have a fundamental relationship with key stakeholders and your staff and the faculty. So that to me has been a core value for me for many years, and I will continue to live by that. And I think that as we look at as we move through COVID, those relationships have been forged even deeper, and we'll be coming out of this even more united as an organization, and frankly, maybe more united as a healthcare system in the nation.
So I want to jump off of that point. So relationships more united, you talk about. We've obviously seen over the past 18 months tensions between management and labor rise because of perceived, and in some cases actual, not enough PPE coming in, or
Right.
the vaccine mandate has certainly created a lot of tension among organizations. What do you see, or how do you build a culture and relationship with labor, with the workforce, that gets past some of what we've seen over the past 18 months? How do we get past this?
Right. So let's not use labor. Let's just talk about teams. So,
Okay.
so I think when you use labor, that immediately starts to have this, this division. So what you have to realize, we're a team, and it's scary. So you think about, one, you need loyalty. So if we're not taking care of our teams prior to COVID, I can't even imagine how that would be working through COVID, because you have to be laser focused on what's important, and having our teams to be able to take care of our patients is a number one priority. So we were very fortunate to really be focused in the area of our number one focus is to retain and protect our workforce. And so that's our teams. And so so important coming in, right? So important coming in about what that looked like and what relationships would I have with our teams. Two would be, as you enter, what commitment do you have? You think about that fateful day of like March 16th, I think 2020, where we shut down all elective cases. I mean, imagine that. I mean,
Right.
all of us, and again, your listeners are saying, yeah, that was pretty crazy to do that. It was a shock to the system. So what do you do with your employees? What do you do with the teams? So we never laid anybody off. We ended up, if they didn't work, we supported them financially. We supported them with childcare. We supported them with additional incentives. We redeployed them so they kept active because they wanted to contribute during that time. So that loyalty that they provided us prior to coming into COVID, we needed to return that loyalty to say, we're going to protect you. You're going to be okay. In many of these cases, what happens is, what's going to happen to me? Any kind of large situations, it's either, something that would be a dramatic change. It always comes back. So what about me? And now that's not being selfish. That's just the reality. So we need to tell them that you're going to be okay. We're going to take care of you, because they took care of everybody before. So that relationship was already forged. And I believe it's even deeper right now, because we did show that we were extremely committed to our teams. So that was important. And as leaders, we equally participated with, with reducing salaries when necessary, and really it was an all-in deal. And we're very transparent. We had clear communication to them, on a daily basis of what was happening. Also think back about the PPE. I mean, we often forget about how scary that was, where our healthcare workers were going home to their families after taking care of COVID patients.
Right.
And they were thinking they're going to train. We're trying to figure out, how is this being transmitted, and, wiping down surfaces. And so we needed to also acknowledge how scary that is for their families. So that was and innovation rose. So what would happen was our teams really became extremely innovative. And they innovated around. We had masks being produced off 3D printers. We were trying to reuse masks and so forth. Everybody was scrambling, obviously, but we had to not hoard. We had to be more creative and innovative about how we start to react to the demands in front of us. And like I said, incredible communication. We listened to the staff. We understood. We had, I think, just incredible leadership in our team here, in our hospital leadership, as well as the faculty leadership. Dr. Good, which is our senior vice president, would do, the 3 things you need to know. So it was highly interactive with our staff. So loyalty, clear commitment to our staff. And again, I'll come back to the relationships. I mean, we were out there acknowledging and rounding with our staff, understanding what the issues were. It was a scary time. And you go fast forward now, I think, frankly, in some cases, it's worse than it was there, because
Right.
you have clearly political issues that are very highly charged. You have the clear division of the inequities that occurred with the pandemic, and needing to really double down on the EDI initiatives, and just many things. We had unrest that going around. It was time. So now you look at where we are today, more important than ever to be able to understand where we are with our team. So we're going to get through this. It's just going to be a matter of, we got to do this together as a team. I'm optimistic. I'm very optimistic because I'm confident in our teams, and I think I'm confident in healthcare in general. So I think it's an interesting journey right now. I've never seen this in healthcare in my career, but we're resilient, we're adaptive, and we're innovative, and we have the leadership to get through this.
I'm curious too, Dan, a couple questions to close out here, but you were one of, as I understand right, I think University of Utah Hospital Health was one of the first systems in Utah to mandate vaccinations for employees. Obviously, we very recently just saw President Biden issue the new orders for private sector employers, contractors, and expanding it across all of healthcare. As you think about your colleagues who have yet to mandate it across their health systems for whatever reasons they may have done so, with this now coming out of the Biden administration, the HHS, what are the 1 or 2 bits of advice you have for them on how to roll out a mandatory vaccine for their staff and get everyone on board with this?
Yeah, Matt, I think you have to first acknowledge it's complicated. I mean, it's there's regions in the United States that have pressures that I think that we can't imagine. So I think what we first have to have is empathy with leaders right now, and understand that this is really hard. We were the first, and we, again, that was that core value and belief system that we said, yes, we're going to go forward. There was a risk to that, because a risk about that, our workforce would leave. They didn't. And so so I think that, in rolling this out, I think this is preventable. And so I think the point is, you have to understand where our healthcare workers are right now, and the pressure that they are under is just enormous. And we just cannot underestimate how important that is to know what they're going through. So if you start putting into the terms of saying, listen, we have to do this, there's no choice. And people have different belief systems, but you look at what President Biden had to do. He had to do that. He had no choice. So, and it's going to be received in multiple ways. It's going to, this is going to be another charged event, right? So,
right.
But my advice is, stay true, keep focused. keep your true north. And we're all in the healthcare for the reasons is connect a purpose about what we're here for. We cannot lose sight of that. And what we're doing is often we drift from the core purpose of what our healthcare leaders are asked to do for the community and our patients. And we just we need to come back to that core belief. And if we can do that, I think we're going to be okay. It's hard, complete empathy, not easy. I don't have advice. I just say stick with it, keep with the true north, connect to purpose.
Got it. And Dan, lastly, in the last minute we've got, I want to pivot a little bit more to a strategic question. As we talked at the beginning, you've had a long career at University of Utah hospitals. You've seen a lot. You've worked in different departments. As you think about a potential end of the pandemic, how does being in it right now? Utah's going through a surge like so many other parts of the country. How are you able to think more strategically 2, 3, 4, 5 years down the road while your ICU beds are all filled up and so forth? So just walk us through in the last minute or so how you're managing that and end of this.
Yeah, I'll break that into 2 points. One is we know what culture can do to strategy, and so we have to be very focused about, has this strengthened us in the culture that we've established? So whatever we do with the strategy in the future, and we've been very fortunate, again, with Dr. Good, prior to the pandemic, we had a strategy 2025. So we had a very directed steps through the 5 years. That clearly had to go on the back burner within this last year. But first and foremost is that you need to assess the culture. And so is a culture going to still be viable and receptive to strategy for the future? 2 is, yes, we all need to continue to be looking ahead. So if you put this pandemic in a micro event, that's a natural disaster, you typically would take a look what's going to happen in the 1, 2, 3 days, and then you look at the 24 to 48, then you look at the week. Well, extend that to, we've been this for 18 months, so you have to be looking at what's going to happen in the next 2 to 3 to 5 years. So a kind of equivalent. So as leaders, we have to keep our eye on both. But the first and foremost priority is what is faced in front of us. But we absolutely need to be thinking through as leaders of the healthcare to be thinking of the next 3 to 5. And what will be just fundamentally important is what the culture is going to be looking like after, and I won't say after, I'll say we'll be continuing to manage COVID. But we will get through this, and we'll be back on track with our strategic initiatives. So yes, all of the above.
Got it. Well, Dan, we appreciate your time. We know it's a busy time. As you're rolling out your agenda as CEO, as full-fledged CEO, with the interim taking off again. Congratulations on that, and thank you for taking some time with us. And please be safe out there in Utah.
Well, you too, Matthew. It was my pleasure. Thank you very much.
Thank you. And I'm Matthew Weinstock with Modern Healthcare. Thanks for tuning into the Checkup.